My brother Max, how are you? It's Michael Green. How's it going?
Happy to be here.
I'm so pleased you made it here, absolutely. We're back to Plan A, what you and I originally discussed, just having a little short conversation about interpreting the art of the cannabis sommelier. I'm getting close, but not perfect, right? And what it is that the patient needs to know. But by way of introduction, Max is a citizen scientist. He grew up in the cauldron of the Denver cannabis explosion, if you will, has had a natural curiosity about all things, all aspects of life, but found a focus, among other things, on the cannabis plant. His book walks you through what he calls the art of interpening, and I wanted him to share with you specifically how that might apply, a little introduction, but how it might apply to a patient, what a patient can do to inform themselves about the bud in their hand. Max, take it away.
Thanks so much, Michael Green. So, interpening is complex, which is why we have multiple courses on it, books, tools, other resources, the Interpening Club. It is a complex topic, and that's because, obviously, as you all know, cannabis is a complex topic. The point of interpening is to help people, patients or adult use consumers, to overcome the strain name dilemma, speciation dilemma, and also a lot of the lab testing that people think is a lot of the lab testing that could help people in better ways. So the thing is cannabis is confusing. If you see my Blue Dream video where I go around Denver dispensaries buying 6 different types of Blue Dream in an hour and showing you how and why these medicines are not the same thing, that's the point, is patients don't have a legitimate resource to know for a fact that what they're being served as a botanical herbal is either safe to consume because someone looked at it from a human consumable quality perspective, not just a fraction of the chemistry that the plant produces, which is what we lab test for, instead of bugs or ripeness, or if it's been flushed, or if it's a quality product for consumption. We don't look for those things. But interpening teaches patients how to assess and look for those things, as well as how to assess if the cannabis is on a stimulant to sedative spectrum and where it will fall in between, which is not based on lab testing. And so I can answer more about that if you'd like.
Well, you know, one of the things you came up, you mentioned your tools. I don't know if you have them handy. Like one, I'm holding the interpening loop, which I think is nothing short of sheer genius. Why don't you go ahead and walk us through your loop tool? And by the way, Max is the founder, and with the Trichome Institute, I forgot to mention that, but this loop is nothing but sheer genius. Max, walk us through.
Yeah, so the loop tool, people think it's a flat card because it is a flat card. It's just that this flat card is very dynamic. The second page here is a list of all the unacceptable qualitative features that you find on cannabis often, both the visual and olfactory. These are the higher qualities that you'll find on your cannabis, and to help you gauge those things. When you smell your cannabis, these are the most dominant things that you're smelling. These are the most dominant terpene types that have the most drastic effects, which is not how interpening works. Interpening is way more complicated than that. But this first page here really shows you what the narrow to broadleaf spectrum looks like. And cannabis is, it's not a gray wolf and it's not a coyote. It's not this ancient plant type that was indica or sativa a long time ago. It's neither of these things. These are plant types that are on a broad to narrow leaf spectrum with consistency in effect type. And so we do have consistency with narrow leaf marijuana varietals, which would be different from an NLH, a narrow leaf hemp type, has consistency within its inflorescence, the shape of the cola, how many pistils it has, the length of them, the girth of them, the structure of the bracts within the inflorescence, if it's more open and wispy and light versus being dense with a more petite amount of pistillate present. And then it just keeps going down the line. And what you can do is you can have any type of flower and not know what its name is or what it's called. Not a sativa, it's not Blue Dream, and your lab test doesn't tell you enough. So if you go through these processes, you'll actually be able to gauge where on that spectrum of psychopharmacy, potency, and quality that these hybrid types will fall within. And so at the Trichome Institute, we know that there are not 2 effect types of cannabis, there are 5. There are 5 effect types of cannabis. And this spectrum of interpening methodology and understanding your cannabis in a deeper way really highlights what that spectrum is so that you can work with it more intelligently.
Through it, basically you're showing, based whether it's narrow leaf or broad leaf, where in the body the cannabis is most active or doing its, for lack of a better term from my end, I apologize, not only show you the density bud, where the aroma perception is, but basically how this plant is typically affecting the body and where.
Right, and this goes, just so we're clear, this is way more advanced than looking at the leaf shapes. And remember, most patients never see the shape of the leaf. All they're exposed to is the flower itself, generally, usually, right? And so there is an aspect to the leaf shape, but it's more about the interpretation of terpenes in the first cranial nerve and the fifth cranial nerve simultaneously. And it's how to gauge and literally feel whether or not your cannabis is vibrating dozens of terpenes that would fall in the category of stimulating versus sedative. And this is the same science as aromatherapy. It's just that you're smoking the same chemistry as aromatherapy, and then you're adding cannabinoids on top of it, which will intensify it drastically. And so this is like really how cannabis works, but teaching patients how to be really intimate with your own cannabis so that you can be assured how it's going to work better.
And by being intimate with your own cannabis, through experimentation and time, for instance, in feeling the effects of the cannabis and how it is affecting you, that in large part or measure becomes a key to your own personal wellness and health with the treating with the plant.
Yeah, we call that the cannabis experimentation phase. And if patients have even just a general understanding of interpening, they can walk themselves through the cannabis experimentation phase, sometimes better than a lot of bud tenders can. And what I mean by that is it's not uncommon to go to a dispensary whose staff is untrained, unlicensed, and uncertified. And they are in the position of, it's the same job as a pharmacist if you're on the medical side of cannabis. A bud tender and a pharmacist is the same thing. They have the same job. It's not uncommon for the confusion within the industry, within the plants, and the vastness that it is to become a chain down the line. And so even though bud tenders do their best and try to become knowledgeable, when they're told that the cannabis on the shelf is a sativa, they believe it. And it could be a stimulant, a sedative variety that they're telling you is a sativa, which would be backwards. And so there's a disadvantage in a dispensary in that setting where if you're a patient and you say, I need a sativa, I need an indica, and I need a hybrid because I'm going to experiment on what works best for me, what happens if they serve you a sativa, and a sativa? And
Right.
it's because the dispensary doesn't have that ability to separate which ones are stimulants versus sedative drug types. Cannabis is the most dynamic drug on planet Earth. There's no substance in the world that could be as dynamic as it. And it's massive. The spectrum of how dynamic it is big. In fact, at the Trichome Institute, we're actually digging in this year really deep into interpening hemp types. And we love medical grade boutique hemp flowers for patients because for a lot of patients, hemp flower works way better than marijuana flower because it doesn't have THC in it, and has all the other good stuff too. So it's dynamic. Cannabis is dynamic, but that's why interpening is a fun thing for people to get involved with themselves and with each other as a community. It's a big conversation. And for those who want to go even way more complex, interpening goes way far down in the deep end into cannabis terroir, cannabis appellation, cannabis typicity, reverse engineering terpene types with terpene supercomputers. So, you know, there's lower levels of understanding because we don't expect everybody to want to become an expert. You don't need to become an expert. But at least there are some tools and some terminology and some engagement to know how to be more intimate with your cannabis so that you can have a little bit more control with it.
That's excellent. You know, I'll share with the audience as well with you. I've given you this feedback before. I went to your site originally after I'd met you and found a couple of introductory videos that are posted for free, not a course that you would pay for, and found it fascinating. I then, of course, wound up taking your introductory level course, and I was with, among others, with Jeff Lowenfels last year at the Emerald Cup, and we got no disagreement about whether something was sativa dominant, broadleaf dominant, or narrowleaf dominant, or if it was broadleaf dominant in indica. And I have 3 guys with me. They all claimed, "Oh, this is definitely broadleaf." And I went through the methodology, or I call from the course, and came to the opposite conclusion: sativa, narrowleaf. A hybrid, of course. The grower shows up, the question comes up, he looks at these 3 gentlemen, including Jeff, then looks at me and says, "Michael, you nailed it right. You got it. How'd you figure it out?" I said, "Max Montrose, interpening." It is an art. One of the things I've found out in treating myself as a patient is there are certain terpene profiles that I want to be aware of. Things that, you're cancer, there's 3 or 4 terpenes that seem to be healthier for me, or healthier for me than other things that I could ingest or smoke. And I'm fascinated by your work and where you've taken this. And again, the loop is genius. The wheel is amazing. I just had a comment from Lennis Worth, who's with us, from Virginia Normal. Blew her mind, your loop. And wants to actually take it to the Virginia legislature and talk to some people and show them exactly what is really going on with this. Can you briefly describe maybe a couple things? We only had a 20-minute interval for this. Things I learned, like I had no idea that you had to flush a plant and you could actually see whether a plant was properly flushed or not, or whether it was harvested too early or too late, or whether it was powdery mildew, spider mite, etc.
All the stuff the industry doesn't look for.
Say again?
I said all of the things that the cannabis industry does not look for.
Exactly.
or a lot
Exactly.
Yeah.
So patient awareness. We're putting patients first. You know, consumer. You know, instead of consumer beware, educate yourself. Physician, heal thyself.
Yeah, and the point is it's not to. This is not to try to poo-poo on the cannabis industry, right? Because the cannabis industry has come. Saying that it's come a long way is not doing it justice. It's incredible how far the cannabis industry has come. It's incredible how well regulated that it really is. And what we respect is it's still a brand new industry, brand spanking new. I mean, compared to beer and wine, which are industries that have been around for millennia. And so it's still new, right? And so we blame it more on its newness, or Uncle Sam in him preventing us from being more public about it, or being legally being allowed to study it, or even talk, right? Like, so
Yeah.
that's where it's coming from. But at the end of the day, what most patients don't know is your lab testing makes you think that the percentage on there is how potent it is, even though they're not including the totality of all the other psychotropic molecules, which combined with the percentage they're posting would be the actual potency. They're not lab testing if it's a stimulant, a sedative, or where it is in between. So they're not giving patients that ability. And then from that qualitative perspective, they don't even look for insects. They don't even have a shelf life on something that's herbal, which is similar to broccoli, right? It's not an extract like cheese, beer, and wine is. And so patients need to be able to learn what the smell of old cannabis is, particularly, so that when they're shopping for cannabis today, they can say, hey, there's no terpenes in there because they've evaporated due to age, which you can smell and you can also see. This is not a quality product for me to want to put in my body. I don't want to smoke this, and it's not going to do much for me. And so that's what it is. It's this thing to be really helpful, and it's to look at cannabis in a very different way. And Michael, I love your story, and I wish I had time to tell the 100 more stories we have where growers or cannabis cups or scientists, you name it, people who basically call BS on this. It's really fun when we show them how it works, because people do backflips. They're like, wow, you can actually smell how cannabis will make you feel. Who knew?
No, exactly. Who knew? I found your whole process, and even that fundamental course I took, I'm looking forward to taking more, because it was illuminating and enlightening. That's the only way to say it. It was mind-boggling. And here it is in my fingertips, in my hand. You know, what might be one person's meat might be another person's poison, in a relative manner of speaking, you know. So if I'm going to put my money out into dispensary, or if I know somebody close by that has something I might like, it's nice to know I'm not looking at some kind of pharmaceutical. I got an FDA guarantee what it is, but it's pharmaceutical. It's factory made, if you will. It's manufactured. Here's this growing, living thing, the flower, the inflorescence in front of me, and it represents well-being and health, plus all the other things we've discussed today. I don't know how much time we have left. I do want to mention, Max has come out the last moment because we had something of a glitch. He has a wonderful, about 43-minute presentation, which we will be putting online. And that'll be available to all our listeners and people that come to our website down the road in the future. I also wanted to thank you for the donation, you and your partners, of the copies of the Interpening that goes with the wheel in the loop that'll come out. And I think we have about 4 or 5 minutes left. We can talk about deli that we chase down when we're together, or we can go on and look at some other things. Tina Gordon's going to be coming on a little while. They close the program, and she's in the terroir. She's in the appellations.
Well, you know, if I had 45 minutes to get into the cannabis terroir conversation, I am happily the most controversial in that space from an ideology perspective, because I've spent the past year in interviewing experts from every angle around the entire conversation, just to try to answer the question: is cannabis terroir even possible the way that it is with wine? And the answer is no, it is not.
But they're not the same things either. But continue.
Correct. Yeah. A perennial fruit that doesn't produce trichomes, or how it absorbs its environment through its root mass, which is deep and doesn't die annually. Just in terms of how cannabis works as a bioaccumulator, doesn't express what it has accumulated from an essence perspective that's detectable, all of those things. But does cannabis have terroir from a horticulture perspective and from a cultural perspective? Yes, it does. But does that mean that you are going to treat it the same way as wine. And the thing is I just hope people are realistic as to what cannabis terroir is and what it is not. But I love having that conversation. So
Yeah, well,
anytime.
the first part of your book goes into it with some beautiful shots, and I appreciated that. Uh, let's just talk a minute about terpenes. Short, short clarification, if you will, about if you're looking at a plant, you can see the terpenes. I don't know if I could try to hold up the picture, but basically, the terpene expresses itself either as being milky, being as clear, or being amber, typically. What do those things suggest to you?
Well, you're talking about trichomes.
Thank you. I'm sorry. Thank you so much. Yeah. Trichomes.
Right. Well, and what's really cool is
the hairs
I wish
of the
I
plant.
could show you. I wish I could show you my desk just 3 feet behind my laptop, where I've got a sample of cannabis that I'm researching with 2 different universities, one in this country and one in Korea, because I've discovered a few brand new types of glandular and non-glandular trichomes that have never been seen before.
Fabulous.
And they're so wild. They're really interesting for lots of different reasons. So I'm actually trichome hunting on this snowy Sunday afternoon. But I think the thing that I'll maybe say about from a terpene perspective is what people need to be open-minded about is the amount of terpenes that you're aware of is not even close to how many terpenes are actually in the plant. And then how many terpenes labs are testing for is also a very small amount. So what people need to understand is when there's laboratories that test for terpenes, they have a computer program that is preset to detect those terpenes. And most labs don't have programs over 42 terpenes in terms of being preset. Some of the terpene supercomputers that we're working with that have started to prove how interpening works, or that people can actually do what I say they can, are detecting over 400 individual terpene types on some cannabis varieties. And so what you can't do is you just can't say, oh, there's a spike of D-limonene in here, and because D-limonene is stimulating, this must be stimulating. It's like, no. What if there's 24 other sedative terpenes also in the plant that you're not looking at that would trump the percentage of the D-limonene that's in there? That's the complexity that we're talking about. And the human body can actually detect that complexity. That's what interpening is.
1 minute.
But I hope that inspires you a little bit more to understand about terpenes and how dynamic they really are in the cannabis plant.
Max, you're always inspiring. I have so much, I get so much a kick out of talking to you every time. I always learn something. You and I have a developing personal relationship that I find very, very gratifying, and again, illuminating and enlightening. I love your natural curiosity, and I appreciate the fact that, especially on short notice, you were willing to reorganize your schedule and make this appearance for Patients Out of Time, our 25th anniversary. Hopefully you'll be available to us a little bit after 3 o'clock. We're going to attempt to put a small Q&A panel together, talking with yourself, Tina Gordon, Bonni, Goldstein, and Uwe Blesching. Just kind of an open melee. We'll see where it goes. But in the meantime, Namaste. Thank you so much for your time and energy. Stay warm, stay healthy, stay well, stay smoked up, brother.
TrichomeInstitute.com for anybody who wants to learn more about interpening. Thank you so much, Michael. Thank you, Patients Out of Time. I've wanted to be a guest for years.
Well, we're going to do it again. We're going to do it again. Thank you for your contribution to the program.
Thank you, guys.
Brilliant.
Really appreciate it.
Always. Okay, so I think I'm back live. So I'm getting that signal. We're going to queue up Uwe Blesching here in just a moment or two. Uwe has been the author of a number of books. First and foremost, to my mind, the Cannabis Health Index. I mentioned that last night to those of you that may have been in attendance, in which he addresses over 100 chronic conditions that are possible to treat with cannabis. That's now up to about 250 conditions, I understand. Uwe is a EMT. He is a firefighter. He's also a social researcher with a degree in Berkeley. His newest book, his second book, was Opioid Addiction, How to Supplement Pain Management with Cannabis. And we're going to have a drawing in a short while if I can get some tickets, and we're going to give away a copy of this book. We'll also be giving away a couple of copies of Ed Rosenthal's new book, Ask Ed. So if you were in the raffle, you got a chance to walk away with a book before we're done. In addition, Uwe has most recently published Your Cannabis CBD THC Ratio. This is from Quick Trading Company, our friends Ed Rosenthal. And signed copies, of course, as always. And we're going to talk a little bit about that ratio, CBD and THC. Uwe, good afternoon. How are you?
It's a pleasure to be here with Mike, as always.
Okay, it's good to see you. By way of background, you are an EMT, a fireman, and also you received your EMT training at Stanford, and then you went on to get a PhD in research, qualitative research, and social research. Is that correct? I may be misstating them.
No, you're absolutely right. I got a PhD from the social science side, and one of its primary focuses was qualitative research, which is a type of research that allows you to take multiple disciplines, multiple philosophies into account, and then distill all that wisdom and all that practically relevant information down to what's most important for the outcome and focus of whatever it is that you're researching. And in my case, of course, having to do with anything and everything with the medicinal aspect of our favorite plant, cannabis.
And what brought you to cannabis? I'm always curious how people found or discovered, or how cannabis discovered them.
Well, it's interesting. I worked for the city for 20 years as a paramedic and as a fireman, and mostly in medical emergencies. And to me, the several entry points or entry stories always had to do with witnessing up front the impact of somebody in severe pain, for example, and then seeing them under the influence of cannabis and what it does to their sense of being, to their sense of well-being, how it shifts and modulates their quality of life in so many ways, that that was always the most impactful door opener and mind opener that got me to be able to look at, when at the time, we were still enmeshed in the narrative on the war on drugs, where we're all, being socialized to one degree or another about the evil weed from Mexico. And so I needed my mind opened, and those firsthand witness accounts were the things that did the trick. Like, to just give you one example, I took care of a patient, who actually fell and had broken his hips. And he had just come back from radiation treatment from, some form of cancer that he was having. And he had third-degree burns to that area of his body, and skin was slushing off. And he was so miserable and in pain. And then, he was at home where I picked him up. He took a couple whiffs off of his joint, and I saw the change unfolding in front of my eyes. And, it was just astonishing to behold, what a couple inhalations would do to just the demeanor of his face. That was an undeniable, clear indication of the mitigating and healing power of the herb.
Excellent. It's always interesting to hear what someone's journey is and what brought this to them. Briefly, the Cannabis Health Index, in the book, you looked at over 100 chronic conditions that could be treated. Chronic conditions could be treated with cannabis, and you lend a mindfulness component of that. In the opioid addiction book, you were looking at pain management through the use of cannabis. But the newest book, your Cannabis CB THC Ratio, you actually focused on 10 primary conditions. And the thrust of the book, using a 6-step process, which we'll get to in a moment, is basically how you looked at 10 conditions that are very, very common, is like a pathway or a backboard, if you will. But you were really looking at how an individual, a patient, can determine the proper dosage for themselves when it comes to treating themselves with cannabis. With that in mind, you start out with chemotypes. Now you have 3 of them. Can you just briefly explain the expression chemotype, and then go ahead and share with us what you mean by chemotype 1, 2, and 3?
Sure, absolutely. When it comes to using cannabis or cannabinoid-based therapeutics, one of the most important things, of course, is to create the precision effect that you want and to avoid crossing that line into the adverse effects potential. And so one of the many ways that you can do that is by looking at the various cannabis constituents that are primarily responsible for creating the effects that you're looking for. And by now there is an abundance of evidence that highlights that specific constituents are better suited for certain patient populations versus others. You know, to provide a bit of context, cannabinoid-based medicine is a very complex type of medicine. It's a newcomer to medicine, and which doesn't mean that there isn't plenty of scientific data that we can use to tap into, create avenues of guidance to make more practical and discerning decisions about what to use. And one of the ways to tap into creating precision effects and to generate a predictability of effect that is also usable in a fashion that it becomes reproducible. So it's not just like, you had one good experience, but you want to have the good experience over and over again. And while there are a number of things we can control, for example, we can't control how much vapor gets lost when we inhale and exhale, either from a vaporizer or from a cigarette. We can't control how quickly a cannabinoid crosses the blood-brain barrier. We can't even control the knowledge and the presence of cannabinoid receptor in the affected tissue, in the diseased tissue, which varies between patients who suffer from different conditions, but also can vary quite significantly even in the same condition. So for instance, if your elbow is inflamed, that elbow tissue will express CB2 receptors at a higher rate than if it's not inflamed. And those are variables that we can control. However, there's a number of variables that we can't control, especially with tested products, with tested flowers, that highlight the specific ingredients, the plant constituents that are unfolding. And one of the biggest differentiator are chemotype-based considerations. And there are 3, like you pointed out, there are 3 basic chemotypes that were established in the 70s by a couple of chemists. And they basically and very simply unfold. Chemotype 1 simply means more THC than CBD. A chemotype 2 simply means a relative equal ratio, although practically speaking, anywhere between a 4:1 and a 1:4 still falls into that chemotype 2 category. And then a chemotype 3, of course, are CBD abundant strains, that are primarily CBD, like, for example, a Charlotte's Web would fall into that category. And if you align the currently available scientific literature that points out which chemotype has been found based on the data that's been published, to best respond to each of these chemotypes, for example, a chemotype 1 works really well, according to the literature, for HIV, AIDS-related anorexia, cachexia. It works well for spinal cord injuries. It works well for chemotherapy-induced nausea and vomiting, for example. While a chemotype 2 with relative equal ratio lights up in the literature to treat patients with fibromyalgia or with multiple sclerosis. While a chemotype 3 works really well for various mood disorders or for pediatric seizures that don't respond to pharmaceutical anti-epileptics. And those are just a few examples of using chemotypes as a broad, a bird's eye view in terms of distinguishing the different types of cannabis and what the data shows, where we might want to begin as a starting point. It's still going to require some fine tuning because cannabis will never be a silver bullet. It's always going to require the patient feedback to titrate the optimal plant constituents that are going to work best for each patient.
Excellent. Thank you for that. And as always, especially when, I don't want to use the word experimenting, when medicating yourself on cannabis, especially if you're new to it, you want to probably be pretty careful about the dosage, small dosage, give it time, give it your own experience, track it, if you will, to determine what's optimal for yourself. You also you had some wonderful appendices, by the way, and maybe I'll come back to those. You have a good detailed discussion of the endocannabinoid system in your book, but you actually have a methodology, which you call Can of Keys. And if I understand it, it's 6 steps to help someone determine how to begin to create the proper dosage for themselves and to track it. Would you mind walking through those keys and maybe even share with us what informed you to create those keys?
Absolutely. It's always been my focus to fine-tune the knowledge that you need in order to optimize the medication, to create the exact effects that you want to create and avoid the adverse effects, which, can be significant. And I've made mistakes, in my personal use, and so I know how unpleasant it can be when you cross that line from a therapeutic effect to an adverse effect. And so over time, it became clear that the more we know about what's in the medicine that we take, the more we are able to fine tune the exact effects that we want. And step 1, we already discussed, is find out what chemotype of cannabis that you're about to take. For instance, one of the things that you can tell right away by just knowing what chemotype is in front of you is, for instance, if I don't want to have changes in cognition, chemotype 1 is not a chemotype I want to utilize. I want to start with a chemotype 3, and if it turns out I need more THC for whatever reason, I can shift the ratio towards a chemotype 2. Excuse me. And so the first step is determining the big separators between the cannabis types, and that is just by looking at the ratio between THC and CBD. And then the second step is to look at the sub-ratio. And, to use an analogy, if you're on a basketball court and you're playing a 1-to-1, that is a different scenario than if you play a 1-on-5 or a 1-to-10 or a 1-to-20. And it's the same thing with sub-ratios as it's concerned towards, generating specific therapeutic effects that you want. So you have the broad distinctions of chemotypes, and now you want to drill down. So what is my sub-ratio? What is the ideal sub-ratio to deal with my primary symptom so that you can begin to dial it in and use that as a variable on your dial to dial in your optimal plant constituents, which may take, a few days to realize the optimal ingredients of what works best for you. So the next step of the things that you can control has to do with determining the dosages of THC and CBD. so it's not just a number in ratio or chemotype, but the actual dosages, because there's a lot of clinical data that we have at our fingertips that determines what is, a microdose of THC, what is a small, a medium, and a high dose. And those things become especially useful when you're dealing with the ingestibles, with edibles, because for various reasons you want to tread very lightly using edibles, just because it takes a lot longer to feel the effect than when you're inhaling a cannabis product. And so it's fairly easy to titrate, to fine tune the feeling that you want to generate, or the therapeutic effect that you want to generate. And so the dosage consideration is the next controllable element that you want to pay attention to. And then, of course, the next controllable item would be the type of or form of cannabis that's available, as far as making choices is concerned. Do I want to use a topical? Do I want to use an oil that I want to ingest? Do I want to use a sublingual spray? Do I want to inhale vapor or a cigarette smoke? And so there are differences that are not so subtle that, for instance, smoking, the onset of an effect is fairly quick. So within seconds to a couple minutes, you'll notice, a shift or change in your perception. While an edible, depending on your stomach content, can take up to 1 to 2 hours. If your stomach is empty, the onset tends to be closer to an hour or less. But if your stomach is full, you may not feel an effect until like 2 hours down the road. But the effects also last a lot longer, while inhalation-based effect will last, let's say half an hour to 2 hours. In some people, an ingestible effect can last up to 4 hours or longer. So if you're looking for longer-term relief, then, an ingestible, would come to mind. If you're looking for short-term relief, perhaps an inhalation-based product, is more suitable. And if you just have a topical issue that you want to address, then a topical comes to mind. And so besides those that I already mentioned, there are additional ones. There are suppositories. There are different types of ingestibles. Anything from an alcohol-based extract to an oil-based extract to a glycerin-based extract. There are edibles, that combine perhaps other plant constituents like terpenes, for example, at different ratios that you may want to engage, which also brings us to the next step 5 in this process of the controllable things that we can use in order to fine-tune the very specific effects we want to generate. And that is creating the entourage effect. You want to bring in certain acid forms, for example, increase the anti-inflammatory potential if inflammation is part of the condition that you're dealing with, for example. Bringing in the data that shows that these are specific terpenes that amplify the effects of the cannabinoids, or that begin to tame the effects of cannabinoids that you want to tame. And so step 5 then looks at, what's the evidence that says what terpenes work well with what cannabinoids. And so that's, as you cook your remedy, here are the various ingredients you sprinkle. Here are the various steps to cook the optimal meal for you, the optimal therapeutic meal to mitigate what ails you. Now, the most important step, perhaps, has to do with creating some sort of session log, some sort of recording of what you just took, so you know specifically what happened to you and what were the numbers involved of each of the ingredients that we just discussed as far as the 5 previous steps are concerned. And then, so if it turns out that it was ideal, that's your ideal recipe. If it turns out it was suboptimal or it created some adverse effects, you make one change at a time. You pick one of those 5 steps and you dial up or you dial down depending on what the effects that your experience was. And so in putting this all together, these are the 6 steps that help you optimize the type of cannabis that hopefully is going to work best for you.
So very much experiential and somewhat experimental, if you will, as you're learning to fine tune what it is that optimizes the effect of the plant in whatever form you're taking it to treat.
Yes, however, it's not based on guesswork, because before you start to take step 1, you want to inform yourself, you want to learn as much as you can, you want to lean on as much of the data that's out there. And if you go to PubMed, one of the primary repository of scientific studies that are published to date on cannabis, and you populate it with the keyword, fill in the blank of the condition that's of interest to you with the word cannabis, and you'll have an instant scenario of hits of either a handful or possibly hundreds of studies that are available to you that you can then drill down and pull the knowledge out of that to make an informed decision about what's a good starting point. Is the data saying, should I start with the chemo type 1? Should I start with the chemo type 2? Has there been sub-ratio information that's in the data? Has there been dosing information in the data? Has there been form-based information or entourage effect information in the data? And so in the past, most of the time, folks had to do this research themselves. Either if you're a cannabis nurse or a cannabis prescribing physician, most of that fell on you. And there are some good resources, including what Patients Out of Time has been doing for its entire existence, is to provide evidence-based data to their patients to make more informed decisions. You've been part at the forefront of the educational process in this field, and so we are trying to add, in fact, to that, by having created the Cannabis 360 platform, which is a natural extension out of the Cannabis Health Index, and we can talk about in more detail if you wish.
Yeah, just let's touch on that a little bit. I don't want to make this into a commercial, obviously, but on the other hand, my understanding, I've looked at the site, you offer a wonderful wealth of data and opportunity for patients, physicians, caregivers, whoever might be interested, to in fact come to some conclusions about what the research is out on a specific condition and what might actually work best for a particular patient in a generalized way. Yeah, if you want to take a moment or two to talk about that, I think that's truly worth sharing.
Yeah, like you pointed out at the beginning of this section, the first edition of the Cannabis Health Index, I list just a little bit over 100 conditions, which at the time were the condition for which there was enough evidence, to warrant inclusion in that book. Now I'm working on the new updated and revised edition, but as you will notice in the subtitle, now there are over 200 conditions, and that's just in the past 4 years, which is a great reflection of the excitement that's going on in the research community about how the constituents of a single plant can in fact be utilized for over 250 now different patient populations, and so the problem with putting it in print media, while I still love holding a book in my hand and why I still like writing in print media, the sheer speed with which new evidence shows up made it a natural extension to develop an online platform, that lines up the available literature with all the conditions for which cannabinoid-based therapeutics show promise. And so that's what, for the last 3 years, Doug Reel and David Rosenthal and I have been developing, and it's online. We did a soft launch about a week ago, and it's available at cannabis.com, and there's a free 1 week option if you want to have a look at it and tap into specific conditions, and to sort of like have all the work that's done in the Cannabis Health Index, all the work that you would need to do for yourself to distill down the actionable data is done for you. Made it really easy to just pull that actionable data that you need out of just by looking at the dashboard or by glancing at the condition in the book that is of interest to you. And so perhaps that's a good point to move on.
That's excellent. I have been to the site looking for check the condition of my condition. I found it very, very helpful, and I've actually had some discussions with a couple of my doctors about the existence of the site and just how much research is available. But very briefly, in regards to that, what is your vetting process? I mean, there must be a lot of articles or research out there that is questionable, as well as some very fine research. There's a way to, in a nutshell, kind of give us what your process is to try to ferret out research that you find is not of the quality you want, or minimal size study. What are some of the indices?
Yeah, so to make a very complex process fairly digestible, let's look at the way it works with a particular condition. So on a weekly basis, I go to PubMed and I look for new conditions for which cannabinoid-based therapeutics may show potential, or I'll come across. So I spend a lot of time in front of the computer looking at what's new, and I search for it. So let's say, and I do this process from A through Z. So I start with the letter A. Let's say arthritis, and I punch in the keyword cannabis, and I look at all the studies that pop up, and I focus on two things. What are the most recent ones? And then what are primary studies and what are related studies? Primary studies are studies that examined components of the endocannabinoid system or the use of cannabinoid-based therapeutics in the treatment of arthritis, or B for, let's say, breast cancer, or C for cachexia, and so on. And then I see if they're already in the data bank. If they're not, I will mark them for inclusion. And so I will go and create buckets of them. And then, we hand enter the most useful, most practical data. Let's say what type of chemotype was used in the study, what type of subratio, what dosing considerations were used, what forms were used, and did they look at other plant constituents? And then, of course, what are the key findings? Did it actually show that it produced therapeutic effects, in this case arthritis? Did it make the condition worse, or did it produce mixed or inconclusive results? And then what were they, and what can be learned from that? And then I pull all of these relevant data, these key findings, and we create a synopsis, that we post with the basic numbers. They're all filterable. So it makes the process to access the actionable data fairly easy and fairly digestible. And so it depends on what you like. You can look at the book and get the data there, or you can go to the platform, the Cannabis 360 platform, and look at the dashboard, look at the trials, and filter for the very specific things that you're looking for. And
you're finding, supported by evidence-based research.
Oh, yeah, we only use evidence-based research, and we grade each study. Like, for example, a laboratory trial, a trial done in the Petri dish, only about 10% of, let's say, therapeutic effects that are suggested, in a lab trial will eventually translate into actionable data when it comes to clinical trials, when it comes to utilizing them on humans. Now, the percentage goes up a little bit once we go and use animal trials, because animals have an endocannabinoid system too. So more of that data, is is weighted with more substance. And then case studies, for example, or expert opinions, cohort studies, longitudinal studies is the next weight up from there. And then we cross the line into clinical trials, and then we grade either non-random trials, randomized trials, double-blind trials, and the gold standard, of course, is a meta-analysis of randomized trials. That typically provides us with the most actionable data that we can use in order to make more informed and determining and discerning decisions about how to progress a treatment protocol for a particular patient populations. And so we go through that process for every single study that is then hand entered into the data bank.
Excellent. Let me kick back a little bit. We briefly touched on dosing. That's a lot about what this book has to do with. It's a guide to precision dosing for health and wellness. You had mentioned terpenes. I seem to recall a pretty good, fairly comprehensive section of the book where, number one, you're identifying organ systems in the human body. You're talking about how our whole notion of receptors has changed. It's more broad than just beyond CB1 and CB2 in the endocannabinoid system, if I got that right. But you also have a pretty good discussion of different terpenes, their profiles. We touched on that with another discussion with Max Montrose, and just how some of these terpene profiles may relate, depending on a number of other factors, with an underlying condition. That some are anti-inflammatory, some are analgesic, others have shown evidence, if you will, or correlations in helping to reduce the growth of cancer, for example. Did you want to touch on that a little bit briefly, or is this too complex?
No, I'll be happy. I'll be happy to talk about that. In fact, it's when I first started, I was a bit skeptical about the potential impact of what I, in the past, many years ago now, considered minute. In terms of the therapeutic prowess that they bring to the mixture, which has been wrong on my initial perception on it, because the more you drill down into the entourage effects potential as far as either the acid forms of cannabinoids are concerned, or the terpenes or flavonoids that are part and parcel of many types of cannabis is concerned, is quite significant. And so the idea of generating an optimal ingredient content for a particular patient, utilizing the data and the science of terpenes or other plant constituents, is substantial. One of my favorite terpenes is beta-caryophyllene. And the wealth or abundance of studies for that terpene alone is significant. And it's fairly easy to access because beta-caryophyllene is a fully FDA-approved food additive. So it's easy to get a hold of. And, research has shown that it actually binds with CB2 receptor sites, which then modulate all inflammatory pathologies and all the conditions for which inflammatory pathologies are part and parcel of mitigating that underlying puzzle piece of what's wrong and what needs healing in patients that have chronic inflammation as part of their symptoms. And so to utilize the addition of cannabinoids, for example, copaiba oil, essential oil of copaiba is the most abundant plant constituents of copaiba oil is beta-caryophyllene. It's easy to buy, pretty much in anywhere, any Whole Foods will have it. And what I do is I put a little bit of coconut oil on my toothbrush and 2 drops of copaiba oil, which has a strong spicy, pungent smell to it, but it's also very refreshing when you use it, as part of your tooth cleaning regimen. And sometimes I get little sore spots, or I want to treat a receding gum line, and it's and sometimes it aches and you have inflammation, and so you put that on there, and within a half an hour to an hour, I noticed the difference. The same thing with footnail fungus. There's one trial that was done here at Berkeley University, just around the corner, not far from my house, where they tested beta-caryophyllene in its oxide form against the fungi, the fungus that produces footnail symptoms. And the results were tremendous. And so there are a few pharmaceutical products that jump to mind that are as safe, as inexpensive, and as effective as a simple terpene that is a fully FDA-approved food additive. And that is part and parcel of the cannabinoid health sciences and what various types of cannabis bring to us as a potential.
That's amazing. Let me ask you, sir, I think our time is getting short. Is there something that we haven't touched on this conversation that you feel like you'd like to put in front of our audience, in front of the patient, something else additionally they may be able to take away, whether it's related to dosing or the endocannabinoid system, the entourage effect, anything?
Yeah, I think that when it comes to most of the 250 or so conditions for which cannabinoid-based therapeutics show promise are chronic conditions. That where Western medicine offers neither cure nor much hope as far as looking towards the future is concerned. All you end up with, a longer list of pharmaceuticals, trying to mitigate an ever-growing list of symptoms that are either associated with the condition or associated with the pharmaceuticals themselves. Right. So I think it's very important for patients to consider the mind-body component when it comes to addressing chronic symptoms. And what's interesting to me is that I think that there is a big overlap between the cannabinoid health sciences and mind-body medicine and orthodox medicine, if you will. And the endocannabinoid system, I consider now a bridge between all of these three fields of medicine. It's creating a link, connecting them all. And the more we learn about the body's innate intelligence, trying to communicate through those symptoms, and depending on symptoms, the idea is, of course, there's either an invitation or a demand for change. And the more we understand what that is, not just as far as physical symptoms is concerned, but also the internal architecture of mind that plays a significant role in creating the shifts that are necessary in order to make a deeper, more longer-lasting change. And so the idea of going to the doctors and getting a pill and walking home cured, simply, that cannot apply anymore as to most of these conditions for which cannabinoid-based medicine shows promise. And so I would invite anybody to at least consider that. And why I think cannabis works so well for so many different patient populations is because it creates a shift in mind. And the right type of cannabis, in fact, will produce not just a deep sense of relaxations, but it will also produce homeostasis or balance within all organ system. And that deep sense of relaxation is part and parcel of that. And so in a way, that's sort of my takeaway from what the plant is teaching us each time we have a cannabis experience, is to relax and to inflect and to reflect on what emotional materials are we not dealing with? What mental, emotional things need shifting that help reduce the levels of cortisols on epinephrine that keep our stress levels high, which in turn, fuel chronic inflammation or oxidative stress or chronic pains. And so there is a connection, and cannabis highlights that connection as its core message. That's part of what makes the connection with the plant so mysterious. And so I would invite folks to try to open up to that mysterious connection that can be there and that can be found in a cannabis experience that uses the right type of cannabis at the right dose to create that deeply relaxed state that is part and parcel of the healing process.
Uwe, thank you so very, very much for participating in our program, for your kind words about Patience Out of Time, kind and real words about Patience Out of Time. I invite the audience to check out your Cannabis CBD and THC Ratio, as well as Uwe's other books. And I look forward to talking with you in the future. Thanks, Uwe.
Thanks, Mike, and I love Patience Out of Time.
Thank you. We love you.
All right, I'm Michael Green. As I said last night, I don't have a clue. I just blew it. We started to present Uwe Blesching's presentation, which runs about 40 minutes, which is going to be online. We're going to have a live conversation with Uwe about 3 p.m., between 2:50, 3 p.m. roughly. In the interim, we're going to bring you Bonni Goldstein. So we're going to roll that tape, and then Bonni will be hopefully available with us for a general panel discussion at the conclusion of this afternoon's program. My bad, mea culpa, clueless. Hit it.
Okay, well, good afternoon, everybody. This is Michael Green again, this time with my friend Bonni Goldstein, Medical Director of Cannabis Center Wellness and Education. That's a California-based medical practice devoted to educating patients about the uses of cannabis for serious and chronic medical conditions. Bonnie's background is she worked in pediatric emergency medicine. She developed an interest in the science of cannabis after having an encounter with a friend and witnessing the beneficial effects that cannabis had on her. For the past 13 years, she's evaluated thousands of patients for the use of medical cannabis and is recognized as an expert in the clinical application of cannabis therapeutics. She has a special interest in treating children with intractable epilepsy, autism, cancer, and other conditions. Her latest book is Cannabis is Medicine. That came out in September. It's published by Little Brown. Her previous book was Cannabis Revealed. And I have no hesitation in saying or sharing that this has been the #1 bestseller I've had as a cannabis book dealer over the last 18 months. The book has sold well. It's easy to read. Bonnie's here with me. Departing from what we've done in the other segments, rather than try to go through the book, I will just tell you that I've been through this book 3 times the last several weeks and looked at it some months ago as well. I think it's probably the best, or maybe one of the best, written books on cannabis medicine that I've encountered. It's an easy read. Bonni covers a little bit of background of the plant. She looks at the endocannabinoid system very clearly. Also looks at phytocannabinoids, what comes from the plant material, of course, whether it's trichomes, flavonoids, terpenoids, and the major cannabinoid components. She gave me information I didn't know. We're up to 140 described cannabinoids now. She also raised, for the first time I've seen in print, olivetolic acid, which I'm not going to get into a moment, but I know it's a precursor molecule to THC, and it shows up in nature primarily in lichen, and it has a synergistic and catalytic effect on the operation of the endocannabinoid system. With that in mind, I'm just going to ask Bonni simply if she would be willing to discuss the essentials of the patient-physician relationship, what she thinks it's necessary for both to bring to the table to try to affect the best possible diagnosis, treatment, and outcome. Bonni, with that in mind, please.
It's nice to be here with you, Michael. Thank you for the invitation to talk with you.
My pleasure.
And thank you for the kind words about the book. It was a labor of love. I have a new respect for people who write for a living. It's not easy. But to answer your question about doctor-patient relationship, I think, what's happened over the last, 20, 30 years is that doctors became, I kind of joke around, it's become very drive-by, like you go in and you wait and then you get seen for 10 minutes and you get handed a prescription and you walk out the door and and it's kind of the nature of trying to survive and make a living out of being a doctor. I once heard another doctor say, we now have just a few things that we offer patients: pills, shots, surgery. And like, whatever happened to the conversation, whatever happened to sitting down with the patient? I know when I was a little girl, we would go if we went to the doctor, if we had to go, you would be seen in the room, but then you would be asked to get dressed and come and meet with the doctor in another room where you're not where you're not so vulnerable. Your clothes are on. You're sitting in a chair and you're equal with the doctor instead of them looking down at you. We've kind of lost that. I don't want to say every doctor's lost that, but I know my own experience going to the doctor, it feels like I'm just kind of, on an assembly line. And that's a terrible way to take care of people, I think. And unfortunately, it's all too common. I think with cannabis, though, the first thing, of course, is that you have to have that conversation with your doctor and know that they are not going to say to you, oh, I don't want to talk about that. How dare you bring that up to me? Oh, are you out of your mind? That's just hogwash. And, the favorite one, of course, is there's no evidence. I still to this day have patients that come in who tell me that their child's neurologist says, if you're going to be in this practice, you can't use CBD. And that's kind of surprising because especially, when most patients end up in my practice, it's because they've tried everything else and there's not much else that will work. And then you're starting to get into the invasive things like, the magnet that they implant in your chest to swipe when you have, and I'm not saying that's a bad thing to do. It's just that it seems to me before you would cut somebody open, you might consider looking at the evidence for CBD, especially for epilepsy in children, and consider it as a possibility. Because again, what's our oath? Do no harm, right? And I really,
I recall that you begin your very first thing in the book is do no harm.
Do no harm.
If I may, interject, you also very early on said in discussing cannabis science that it's not a miracle. It is science, and that you are very put off by individuals who say, if you ask them, what do they know about the endocannabinoid system? If they don't have an answer to that, they clearly really don't have a clue. They haven't bothered to look.
That's right. And so how can you have an understanding of something if you really don't, if you haven't read about it, if you haven't, so often patients will ask me, well, doctor, what do you think about this medicine? And the first thing I'll say is, oh, that must be a new one. I've never heard of that. Well, I don't have an opinion until I read about it and learn about it. But I think, of course, cannabis has this, all these myths and preconceived notions that exist because it's part of our culture. We all grew up hearing about, pot, weed. However it was framed to us when we were from when we were young, is kind of how we think about it. And most physicians, remember, we go through medical school and residency where it is reinforced in general, for the most part, that cannabis is a drug of abuse. And here I am trying to change everybody's mind to go from not drug of abuse. It can be, and certainly does exist for some people, but it's a completely different use pattern and application when used medically. And as I write in the book over and over again, especially under medical supervision. And I say it over and over, it is a wonderful tool to have in your toolbox as a physician, as just the same way that, look, I have a lot of patients that take melatonin. This is natural. I have patients using omega fatty acids as part of their they may call it a wellness regimen, but it's a medicine in a way, right? And why shouldn't we look at, to me, cannabis had it not been taken away from us back in the 1930s and 40s, I really believe that all of us, I believe that we wouldn't have so much illness that we have now. But I think all of us would have plants in our backyard, or we would have a local apothecary that we would go to where we could get various cannabinoids and, all other plants. I mean, we've been victims of this hardcore shift to pharmaceuticals, and we've left all the natural stuff behind. And here cannabis is now reemerging as a highly valuable medicinal and wellness component. And I just think the medical community can no longer ignore that. And that's one of the reasons I wrote the book, Michael, was to not only educate patients and people who are interested, or people even in the industry, but also to hopefully, change some minds in the medical field from that negative view. Just to get from negative to neutral is kind of a difficult climb, but then really to get somebody to say positive, oh, maybe this might help. And maybe somebody would think of, oh, that patient that's really been struggling over years without finding the quote answer to their problem.
Well, again, your book, I think, offers the key to enlightenment clearly. And, as a layperson, and I'm not a physician, but if I were medically trained, as I was at law, legally trained, when I encountered something that was not one readable, fact-based, has references, and it acts as a guide to take me through something, that's what I look for in that type of specific professional literature. And again, I think you've accomplished that. But again, I think the key to this conversation would be, again, take us back into the consultation room. You're encountering a patient's encountering you. What should the exchange be like? What is it you want to know as a physician? What do you want to hear from the patient? And are there tips for the patient to be able to communicate effectively with a physician that's receptive?
Right. Well, and it's interesting you ask about that. So what I do in my office is not that much different than I did when I worked in the emergency room. You doctors are trained, the first thing they drill into you is, introduce yourself to the patient. And then of course, take a history, a detailed history. How long have you had these symptoms? Did this symptom come before this symptom? I mean, really try to tease out what is going on with the patient. I'm fairly lucky in a way because I practice cannabis specialty. 100% of my patients are already diagnosed. I mean, some may have what I might disagree with the diagnosis or think that there's something else going on, and of course I'd share that, but I still take the full history, because if somebody's in my office, they're clearly seeking help. And that means that what they're doing currently to treat their condition is not working. And that's part of the history too, is what have you tried? What have you done? And what was the outcome of those particular interventions? And one of the very important questions too is, have you tried medicating with cannabis? Because there is a different approach for those people who what we call cannabis naive, versus somebody who's been using cannabis for a while, or at least who has explored cannabis. Maybe they haven't figured it out yet, and that's why they're visiting me. But I do find that those who are cannabis naive, and again, in the pediatric population, it's a little bit different, but in adults that are cannabis naive, when people make it to 60 years old or 75 years old and have never used cannabis before, there is for the most part, a nervousness, as you can well imagine, right? They've heard about cannabis. Like, I've had people ask me, am I going to see trails? Am I going to hallucinate? So there is this, and remember, especially in older patients, they were really, it was really stuffed down their throat. This is like LSD and heroin. You're going to trip and so on. And, I do a fair amount of explaining that that's not going to happen, especially under medical supervision, because dosing is going to be controlled. So I think more importantly, when somebody is approaching a doctor who, let's say their regular doctor or their oncologist, their rheumatologist, somebody who that has been involved in their care, and the patient is cannabis curious, but is nervous about bringing it up with the doctor, right? So, right. One of the things that I'll share with those patients is, of course, if your doctor doesn't know very much, you really should seek consultation with someone who has more of a specialty, but you should have a conversation with your specialist. And I think that includes, like, if you're feeling very nervous about it, one of the best ways to approach it is just to ask your doctor, what do you think about medical cannabis? It's a simple question, so you can feel the doctor out, especially if you're really nervous about bringing it up. Now, there are people who aren't, and they'll just say, hey, doc, I'm using medical cannabis and it's working wonders for me and I don't need my sleeping pills anymore, right? Because there are some people who are not worried about their doctor judging them. But based on surveys, that especially surveys of seniors, one of the biggest barriers to people discussing medical cannabis with their doctor was they were afraid that their doctor would think that they were a stoner or would look at them differently. That's how people answered that question. Why haven't you talked to your doctor about this? Because I don't want him to think that I'm a pothead. And that's really unfortunate.
Till recently, historically illegal. Almost every place you went, who wants to admit to doing something that's illegal? Just,
Yeah.
based on what you perceive the other person might be perceiving when you share that. So that's part of the hesitancy too, I'm sure.
I agree with you. And unfortunately, luckily, here in California, we've had laws now, we're talking, 20 plus years. And, there's this saying that, information doesn't trickle down to your doctor it takes 17 years you've probably heard that statistic, which is scary. But I think now there's so much talk about it. There's so much in the media. But again, if you're nervous about it, hey, doc, how do you feel about medical cannabis? And if they just kind of blow you off, then you have two choices. And one is you don't discuss it any further. It's your comfort level. And I'm not going to get in the middle of your relation and say, you have to talk to your doctor about that. But if that's your comfort level and you just want to walk away from it, that's fine. But I think then the next step is, and all doctors now have email. So the next step is to do a little research on your own about cannabis for your condition. For instance, maybe go on Google Scholar or PubMed, pull up an article or two, maybe pull up an article about the endocannabinoid system. And Mary Lynn has even said this very gently, share this information with your doctor and say, after reading this, do you think that, this is something I'm going to do? I'd like to have your support. And I think that's the way to present it to your physician, so that you can, especially if you have a physician that you really like, who just happens not to be educated on this. It shouldn't be a big black mark on the doctor. I mean, look, it's the system that created doctors to feel negatively about cannabis.
It's interesting you say that. I'm sorry.
No, go ahead.
Seems to me historically, if you go to see a professional, again, doctor, lawyer, accountant, these people, in your mind, typically, in the average consumer's mind, if you will, these people have the experience, they have that knowledge. You're looking up to them. You're naturally generating a certain amount of respect because of their credentials, degrees, and the nature of their profession. So in some ways, by assisting education your doctor, it opens the doors for further conversation, perhaps, and in a manner of speaking, becomes a great equalizer, making it a two-sided conversation rather than a one-sided conversation. Is that?
Yeah, I agree. Absolutely, Michael. And I think, some people ask me, how did you get into this? And of course, I have my personal story. Everybody has a personal story about this. Everybody knows somebody who benefited at this point in time. We all know. And I'm always happy to share that, some of the doctors who were not interested, especially the pediatric physician specialists that often my patients are seeing, they're, started off, and look, I've been doing this 13 years now, so I've seen its kind of progression through time. Early on, we basically didn't tell anybody. I kept it to myself. We kept it as a secret because we were terrified that somebody might call Child Protective Services on the family. But then what happens is here's a child who's on medication, who's having tons of seizures, who starts a program with me. And, you know, if we're lucky, they respond. And now they're going to the doctor and the mom has to say something because they don't want to be on the medications anymore. And meanwhile, the child is completely different from the last time the doctor saw the child. And I'm always so happy to share that some of the pediatric neurologists and pain management doctors that I've worked with, and some of the pediatricians, pediatric oncologists, after they see the benefits, and that's the thing, is they might trust me, right? I'm a well-trained, well-respected person. I have clean record, the whole thing, but they want to see it. And when they have that patient in front of them, that first patient in front of them that says, you know, my son went from, 10 seizures a week and he hasn't had any seizures for, 3 weeks now, or whatever it is.
Right.
It's hard to deny that when you're seeing it with your own eyes. And so then what happens, I think, is that there's a switch that gets flipped and the doctors start to get engaged with it. Now, of course, they may not want to learn everything about it. They've got their own specialty that they've got to deal with. And, when you're a pediatric oncologist, you're responsible for children's lives and for giving them pretty hardcore medications and trying to save them. Same thing with neurology and some of these other more difficult things that we see especially in children, but really adults as well. And I don't expect them to learn everything about cannabis to be able to manage a patient's specifics of their cannabis regimen, but certainly they should be on board and included. Everybody should be working together as a team to help that patient. So I do think that the specialty of cannabis medicine is something that we're going to see more doctors hopefully enter into. It's very rewarding. Sometimes it's frustrating, but so is, regular medicine, very frustrating. Yeah, but it's just such a nice way to practice medicine and again, to stick with that do no harm, because I do find cannabis to be very non-toxic and very safe. And really just years and years ago, I attended this conference in another country where they were considering approving cannabis, and they asked me to come speak. And Michael, one of the things I said to them is, all your fears, everything you're worried about, it doesn't happen. Under medical supervision, patients usually don't go rogue. They will listen to you. They will follow your directions. They trust you. So whatever it is that you're worried about, that someone's going to turn into a stoner or someone's going to be, dabbing all day under, under your supervision, that just doesn't happen. We just don't see that. We see patients being almost too conservative with cannabis sometimes, right? And so I tried to explain that all of the fears that come from the propaganda, not from the true use of cannabis, but from the propaganda, all those fears are unfounded. And people have heard me say this. My husband calls me a chicken in a mommy suit. So like if you unzip me, there's a chicken inside. If I'm using cannabis as a tool in my toolbox to treat patients, and look, people don't have to trust me, but trust me, I am a very conservative physician and I'm very careful and I always weigh the options. And when you do that with cannabis, you're just not going to harm anybody.
That's wonderful to hear. I mean, I know in the book you've touched, there are certain people that suffer, for example, endocannabinoid deficiency syndrome, or there's certain people that, and of course then cannabis would be indicated. There are certain people that have negative reactions to it, that just not appropriate. Finding the right balance when it comes to dosing, that's things that you discuss in the book, but I assume, of course, that's part of the ongoing conversation when you have somebody in treatment. So there are some, not false steps, but there are some preliminary steps to be taken in the physician-patient relationship to determine, again, what the proper dosage is, whether or not there's a circumstance here for whatever reason it's not appropriate for an individual, and of course all the indications of and all the conditions that can be practiced that they're susceptible to treatment, where in fact it is indicated.
That's right. There's, there's a lot of conditions for which there exists either my own clinical experience, what you might call anecdotal experience, and also now, there is a fair amount of research, and everybody keeps repeating that same, oh, there's not enough research. Well, when it's Schedule 1 and you're prohibited from doing human clinical trials, well, sure, let's just put that out there. If you're going to prohibit me from doing research, and then you're going to turn around and say, well, there's not enough research, we're at a point now where we just need to move on from that. It just needs to be descheduled.
Yeah.
And let us figure it out. It's going to be challenging at best, because cannabis is not, when we talk about cannabis, is it CBD dominant cannabis? Is it something that has both CBD and THC? Is it THCA? Is it CBG? There is so much research to be done in human trials, and we're just, again, like, we're not able to do it. But my big thing is, why not? Where's the fear? We now have enough evidence to show that it can be very helpful for people with chronic pain, and with an opioid crisis that we have. Why are we not studying cannabis for all kinds of pain? Why are we not able to enroll patients, and publish 20 studies by the end of 2021? What's the fear? Are we going to find out it works? I'll tell you right now, it works, right? I have pediatric patients who are on opiates because they get such severe pain after getting chemo. They're on morphine because they get mouth sores that are just horrific. And low dose, like 1 milligram of THC, they get their appetite back. Their pain is gone. They're not under the influence. And they're running around the house playing like a typical 4-year-old should play, because they got 1 milligram of THC in the morning, 1 milligram of THC in the afternoon, and 1 milligram of THC at the end of the day. What are people worried about? Are we really going to say that we're more worried about THC on that child's brain than morphine, or than the chemo that's being poured into their body? If the child can't do geometry when he's 16, you're going to blame the THC. What about these other drugs that the child took? Nobody seems to worry about those things. So I feel very strongly that the research has to get done. It's not going to stop me, of course, from treating patients, because clinically, we just see so many benefits. And, Michael, I ask every single person that comes across, whether it's a new patient who's tried cannabis on their own, or a follow-up patient who's, been my patient, no matter what, every time I meet with them, I say, any negative side effects? And so, for instance, yesterday, a woman said to me, no, she goes, I don't even know what they would be. What are they? Right? So,
Sure.
and again, under medical supervision, someone using it, not abusing it, using it. We trust people with all kinds of pills. You want to tell me we can't trust them with cannabis is just ridiculous. So in general, medical patients, and I even say this in the book, should not be having side effects, except very rare situations where maybe we're going super high dose for some particular reason. But in general, any side effect you might have from your cannabis regimen can be mitigated by changing the cannabinoid, changing the strain or chemovar, changing the dosing, changing the timing, making all these little adjustments to get it to fit you. The majority of my patients using cannabis for whatever condition, chronic pain, epilepsy, autism, they do not have side effects, because we dial in the dosing and the products. One of the important things to understand is that the one dose isn't going to do the trick. You have to kind of, hang in there a little bit. When you're using natural modalities to treat, be prepared that it's going to take a little time to feel better. I joke around that if I'm out of shape and I go to the gym tomorrow, I'm not in shape tomorrow night. If your endocannabinoid system or your chronic illness has been ongoing for years, you are not going to take one dose of CBD tomorrow and feel better. You might start to feel better, but remember, you're not going to kind of achieve that balance for some time. This is natural medicine. You don't change your diet in a day and feel better. It's usually down the line. It's usually 1 month, 2 months, 3 months. You start to feel your body kind of slowly getting back into balance. So people have to understand it's not magic. And one of the things I think that we have been kind of brainwashed into is, you know, here's a prescription, take one pill and you're going to feel great,
Sure.
you know?
Yeah, and call me in the morning. No, exactly. And I mean, what we've witnessed, looking back over the 25 years of patient style time, beyond that is slowly, finally, there is the emergence of research. There is enough anecdotal evidence that presents itself that certainly sustains the conclusions and the statements you're making. I will throw out to you, and you may not be familiar with it, one of our other authors was Uwe Blesching, who's now involved with Canna Keys, an organization he helped find, which is actually a platform for patients and physicians and the curious that actually has aggregated a lot of this research. That's something you may want to look to as well in the near future. It may be of help to you. But, you know, I think a lot about pharmaceuticals. Without going into my health history, I'm taking more pills than I ever have before for some very specific reasons and looking to supplement or avoid those pills by attempting to treat myself with cannabis and with some, you know, certainly with some success. And I don't expect a miracle cure. As you said, it's not a miracle, it is science. And
That's right. And it can coexist. And it can coexist
Yes.
with other medications. It doesn't have to be all of one thing and all of another. I have many patients who are beautifully managed with the addition of cannabis to their current pharmaceutical regimen. It doesn't have to be this philosophy of, no, I'm not, because again, as a conservative physician, if something is helping and it's working and the overall balance is benefit over risk, and that's how everybody should look at their health. When benefit outweighs risk, that's a positive for you. That's when you get to choose, okay, I'm going to opt into this benefit. There's no question that that pharmaceuticals and cannabis can coexist. Now, that being said, one has to be very careful about drug interactions. I talk about it in the book, but there's also websites you can check out. And again, always if you're on medication, you should always run it by a physician or even a pharmacist. There's some really nice groups, like there's the, American, I think it's the Cannabis Pharmacists Association, where they actually educate about the drug interactions and about cannabis, because look, we have to have everybody involved. If we're going to use it as a medicine, we should talk about it as medicine, but we have to be very careful that we are not going to harm anybody. Again, going back to that do no harm, be careful with other medications. And so, for most people, they may just need to opt into one consultation with somebody who's knowledgeable about cannabis, just to kind of get them on the right path, right? Now, one thing too that's really interesting is that when you talk about somebody aggregating data, I find it's really helpful for patients to keep a log or some type of—
I was going to ask about that, so thank you.
Some type of journal, so that you can look back at what worked, what didn't work. Sometimes, and this is really important, sometimes you have to take a little, kind of go higher on the dose before you realize, oh, that's not my dose. I think I was better back here. So sometimes patients will say, well, what's the max dose? Well, to me, it's not really so much about the max dose. It's really about listen to your body. What is your body telling you is the dose at which you felt the most benefits? And again, sometimes you have to pass that up and say, oh, nope, that's too much, and then back up to it. It's important for people to realize that this poor plant has been vilified because of one compound, right? Out of its over 500 compounds. And it's just so silly. It's just so, I feel like the fact that we are even still talking about that cannabis is a Schedule I in this year, 2021. I'm so hoping that this new administration opens their eyes and allows us to move forward, with more research, with research that would be helpful, right? I don't know that it's going to change that much, but I think it would be really helpful for me when somebody comes in who has a very significant illness to be able to say, well, this is what the study showed. So that at least gives you a place to start, right? So if I found out that a particular cannabinoid did not help anybody with epilepsy or anybody with neurodegenerative disorder, I would not encourage them to try it, right? And
Exactly.
right. So,
Sure.
Yep. And that's very, very important information. And then also, if something is going to help with a serious condition, should we start low dose? Should we start higher doses? Like, you don't want to waste a patient's time and their precious resources piddling around with little baby doses when, you know, here we do the research and we find out, let's say for Parkinson's or a neurodegenerative disorder, higher doses of CBD work better, right? And it can also take time for them to kick in. It's important to have this information out, not for every condition, for the person who has this, you know, insomnia, and I'm not poo-pooing insomnia. Insomnia is a multi-billion-dollar business in this country. People want to sleep. They want to be productive during the day, but they want to sleep at night. And, you know, there's lots of sleeping pills on the market. There's lots of over-the-counter sleeping things. There's all kinds of things that you can do to try to help your sleep. I find with sleep, most people figure it out on their own, and they figure it out pretty quickly because cannabis seems to be pretty effective for about 90% of patients who are looking for sleep. And that can be a very simple thing that we can treat. But same thing with like anxiety, and even for chronic pain for some patients, if they can't, you know, sort it out on their own, they may seek help with a physician, but they might be able to self-medicate. And I think people should be trusted to be able to self-medicate with cannabis. There's really nothing dangerous about that. I just think that for certain specific conditions, or if you're taking certain medications, that's probably the person who should seek help.
Well, Bonni, thank you for that. It's 2021. Maybe we are in a new beginning with a new administration. I will mention briefly, Patients Out of Time has a resolution to deschedule that's available on our website, and we're still looking for and gathering signatures. I just want to thank you for all that you've brought to the table today. I mean, we've covered a pretty broad band of things, and but I think I think you've answered the fundamental questions of, you know, that go to a physician's-patient's relationship and what that needs to encompass, and done a pretty good job of just kind of rolling back a bit of the mystique.
Well, thank you.
This fabulous plant that is now so big a part of so many lives. Thank you so very, very much on behalf of Patients Out of Time, myself, and look forward to running into you in person in your future. And again,
I hope so, Michael.
buy Cannabis is Medicine at your favorite bookstore, or you can enter the raffle for a signed copy and pick one up from Patients Out of Time if you're the lucky winner.
Hi, I'm Ken Walski. I'm a registered nurse, and I'm Executive Director of the Coalition for Medical Marijuana in New Jersey. I'm also on the Board of Directors of Patients Out of Time. Since 2004, I've been to 9 Patients Out of Time conferences. I believe these are the finest medical marijuana conferences you can find. They bring together some of the top researchers from across the country and around the world. These researchers discuss the latest developments in our understanding of the endocannabinoid system. At the 2010 conference in Warwick, Rhode Island, under the leadership of Mary Lynn Mothry, a couple of nurses and I formed the American Cannabis Nurses Association. The ACNA is now a thriving organization, and I urge all nurses to join it. I look forward to the 2021 conference, and I wish Mary Lynn and the organization continued success.
So good afternoon, everybody. Michael Green here on behalf of Patients Out of Time, and I am with my friend Tina Gordon of Moonmaid Farm. Tina's a grower in southern Humboldt. If I understand it correctly, she's on 40 acres, about 33 1/3 mile from the Pacific coast, in an area that might actually be described as terroir. Tina, first and foremost, and you're a grower, of course, first and foremost, would you tell us a little bit about your background, where you came from, and how you got to southern Humboldt County in Moonmaid Farm?
Absolutely. And Michael, thanks for having me on today. It's a pleasure talking with you. And it's really an honor to be part of this Patients Out of Time conference. Thank you.
Well, privileged to have you, so thank you, truly.
So my background is not at all country or rural. My background is very urban. So I'm from San Francisco, California, where I was born and raised. And my entire life, really, I lived in what I didn't really acknowledge as kind of a synthetic environment, you know? So I often thought, well, where do these trees come from that are on the sidewalks, right? Like, where do they go? And what's underground? What's beneath the sidewalks? What would happen if I peeled these up? But really, I had no consciousness of the fact that I was living in a natural world. And so as an adult, I was playing rock and roll and making art and living as part of like this underground culture, you know? So my life was going in between indoor space to indoor space, to play music, to go to art shows, to make art. And I didn't have a true recognition of the natural forces. And I would say, of course, I was aware that there was sunlight, but I was very unaware of the night sky. I was very unaware of the subtleties of night light and what was happening during the night cycle. And so it really wasn't until I came to Humboldt County and really started working with this plant, which is cannabis, that I had this awakening to the fact that I was living on a natural planet, meaning a living planet. And I was living in a living environment. And it took this dramatic plant to teach me this, because no other plants, no other trees, no other living things really brought me into the consciousness of the cycles of the seasons and how the natural forces work in alignment with each other and how they're integrated and really create the magic that we live in.
What actually drew you to the plant? How did you connect with cannabis?
Well, I came up to visit Southern Humboldt and met an incredible woman who was a jazz drummer. And I was a rock and roll drummer. And this jazz drummer just a lot of different punk rock and hard rock bands. And this jazz drummer totally blew my mind. I'd never met an older female drummer in my life. And I decided when I met her that I needed to make a documentary about her. So I ended up spending time in Southern Humboldt and ended up transitioning to Southern Humboldt through all these different transitions in life and settling in this area. Well, I'm actually speaking to you now from the house on the land that she had built. So I am now living at on my mentor's property. I ended up buying my mentor's property.
A true beneficiary.
And we had this incredible connection. And really, it wasn't about plants. It wasn't about cannabis. It was about playing drums. So that was our connection. And I still wasn't in love with this plant until I saw a full season from seed to full flower. And I saw its incredible power. I saw this small seed grow into this gorgeous, massive 14-foot queen. And I was so blown away by its power and its life force, its energy, the way it feels and smells. And I just felt, I fell completely in love with this plant.
Well, it's apparent that you have a passion for that. And that, of course, became your monograph, Moonmade. I'll hold one up here, which I met you at the Emerald Cup in 2019. You came up to the table where I was working with Jeff Lowenfels, and I think Ed Rosenthal was there at the time, but perhaps not. And you laid this book on me. And I've got to tell you, I look at a lot of cannabis books. This has become one of my arguably all-time favorites, and I'm going to use that word again in a moment. And you start this book after talking about where you were located by writing cannabis is arguably the world's most powerful plant, and it's expressed in the female form. A deciduous plant, it's the female expression of the plant that produces the chemical compounds and terpenes that make it the powerful plant it is. These hardy plants produce eye-catching flowers that revel in color, fragrance, and size, branching out in all directions to capture pollen. She is a diva. She is queen. She is beautiful, adaptive, and enduring. She sunbathes in the ultraviolet light by day and restores in the moonlight every evening. She thrives in nature's variation of subtle daily differences. This is not a grow book. This is a book that's experiential. Basically, you attempting to capture your experience in totality of what it's like to nurture and be nurtured by the cannabis plant.
Absolutely. Well, this plant really became my teacher. And it was because of this plant that I had this recognition. I experienced a recognition of the environment the plant was living in. And so as I started nurturing this plant, the first thing that I nurtured from seed to full expression, you know? And I didn't grow up with pets. I didn't grow up with gardens. And so as this was happening, I started recognizing the way that air was affecting this plant, and airflow, light and the quality of light, water and the quality of light, water and the quality of water, food and the quality of food. And it really made me question how all living things become well and become healthy. And it taught me not only how to nurture this plant, but how to nurture myself and how to nurture others. And so it really was this organic and unanticipated experience. And also something that really struck me was that this is a dioecious plant. So I started understanding the difference, of course, between male and female plants. And I never truly contemplated, you know, what pollen is, what pollen means. I never really thought about plant sex, you know, until cannabis drew me into thinking about plant sex, because that's what this is all about. And this plant that expresses in the female form, it's the female expression of this plant that is getting everyone high. It's the female expression that is doing the good work, that is helping people with all sorts of, you know, in a medicinal sense, in a spiritual sense. And it has the ability to shift consciousness. And it's also an incredibly resilient plant. So I think that it speaks to the feminine essence and feminine energy in the way that, in its resilience, in the way that it grows, in its expression, and the way that it's loud and colorful, and it smells like it's the most incredible smell during full bloom, to wake up at 5 a.m. when the plants are just vibrating with scent. It's incredible. And you can smell them just across, you know, across a garden. You can smell the plants.
And you approach this, the smell of cannabis flowers wafting through the air absolutely is something to behold is the wrong word, something to embrace, to breathe in. And the power just in that is truly amazing. I concur with you. I was looking at something the other day, which just seems to fall into all this. Rachel Carson wrote years ago in Silent Spring that those who contemplate the beauty of the earth find reserves of strength that will endure as long as life lasts. There is something infinitely healing in the repeated refrains of nature, the assurance that dawn comes after night and spring after winter. You've spent all these hours. It doesn't sound like it's all just toil. It sounds like a lot of enjoyment working in the garden. Your technique is regenerative. Is that what I understand? Would you spend a moment or two just sharing with our audience your approach to the cultivation?
Yeah, absolutely. I mean, this is one of the reasons, or the way that I knew that this plant became my teacher, is that I started learning things about myself and my perspective on the world that it completely shifted. So as a sensory experience and as a tactile experience, this also became something that I was recognizing as an intuitive experience. And to truly embrace one's intuition as your deepest guide, that's what happened. And so with that, and the observation of how this plant was thriving in the natural world, I started recognizing the plants that were surrounding it. I started recognizing the fact that I was in an oak grove. I'm in an oak grove. It's this gorgeous grove of beautiful oak trees. There are 3 different kinds of oaks here and many other kinds of trees. And what this land provides is most of what this plant cannabis needs to not only survive, but thrive in this environment. And with that recognition, it really drew me into regenerative farming and a regenerative way of thinking. And the whole concept really is contributing more than you take. And so what does this land have to contribute? And how can I then participate in contributing my life energy toward what is good for this plant? Because it's this plant then that if I can grow this plant in such a way that it can thrive and express fully, then it can help a lot of people, and a lot of people can enjoy it. And so really that's my contribution. And so I started reading about regenerative farming, permaculture, and discovering things like hugelkultures, discovering things like sheet mulching, or really how to build compost and cover cropping. And so all of this became the working philosophy on how to cultivate these plants.
That's just so amazing to me. To me, the regenerative movement is something that's kind of modern. I just stumbled across a segment on NPR the other day talking about bio underground, people discussing regenerative farming, trying to convince the world that there might be a lot to be said for not using artificial pesticides and, and nutrients and insecticides, et cetera. And the presumption from I don't mean to sound naive. I think I do know the answer, but essentially you're using what nature offers to nourish in nature.
Absolutely. And this plant was really just the beginning of an eye-opening experience that clearly and obviously nature does it best, you know? But if you're living in an urban environment where you have no connection to nature, you just don't have the opportunity to see that. And so really understanding that this isn't anything new. This is how the world has been. This is how the world became. This is the planet taking care of itself. And so it's really like, it's biomimicry. We're just we're trying to copy what nature's already doing. And instead of getting in the way, trying to help.
That's, I just love it. Everything you have to say just always continues to resonate and strike a chord with me. I'm fond of saying it's not the whole plant, it's the whole planet. And that's the lesson that I'm learning from cannabis as time goes on. You write that nature provides us with the greatest grow room on earth. Sun cycles offer full spectrum light. There's no simulation that can fully replicate the cosmic light bulb we call the sun. In the heart of the Emerald Triangle, we liberate the plants and grow them in the sun as nature intended. Mixing in harmony with the light of day is the importance of the night cycle and the subtleties of the moonlight and night sky can provide throughout the celestial seasons. Just think how much these nightly subtleties affect these highly intelligent plants. What do they know that we don't? We have a lot to learn from cannabis and the cycles under which it thrives. Take us for a moment into the moonlight or into the evening and into your grow. Can you add to what I just read? And I'm sure you can.
Yeah, absolutely. You know, when I first transitioned to Humboldt County and I started living here for a length of time and tuning into the night cycle. So when you're living in a city, there's streetlights everywhere. And you don't really notice that the moon has cycles. You don't notice how much that affects the light when you're standing under a street lamp. And so I remember a night when there was this incredible full blue moon. And there was blue light just like flooding this room through windows. And it was brighter than twilight. It was like, and the most incredible quality of light, just this very cool blue. And so I went outside and I went for a walk. And I'd never done that. I have never done that under anything but artificial light before, do you know?
What was your age then? I'm curious. I'm not trying to pin you. I know a gentleman doesn't ask a lady's age, but nonetheless, like how old were you when you were having?
I was a full adult into my 30s at that point. And I just had lived a very different lifestyle. And so seeing this light, and I heard of blue moons, but I never knew a blue moon truly existed, do you know? I never knew that like that light was truly blue light. Wow. Absolutely incredible. Which, and so because of this light, I was looking around and starting to tune into this plant, which I knew to be a photosensitive plant. And I thought, well, how is this light and the quality of this light affecting this plant? And I started tuning into the moon cycles. And well, how do those nightly cycles affect the plant? And there are these subtle changes every single night. And of course, based upon a monthly cycle, right? Or that monthly calendar is based upon the moon cycles. And so I looked up farming by the moon, which led me to lunar farming. And I've been following a lunar farming calendar ever since. So that's how I know when to crack seeds, when to plant starts, when to harvest. And it's not only cannabis, it's other plants as well. And so it just brought me into that consciousness. And something else about light and the quality of light, it's that I started tuning into the quality of light over the length of a day, and how it often begins in kind of an amber glow and it ends in a cooler blue. And this is true with the cycle of the season as well. If you consider the beginning of a season and the shorter day length and the cooler weather and the cooler light, and then the autumn, and when the sun is lower in the horizon, and the warmth of that sun and the glow of that sun and the amber. And when that light cycle, as that light cycle decreases, well, that's what triggers these plants to go into bloom. And so it's not only the day cycle, it's the seasonal cycle, do you know? And the way that all of these cycles work with each other. And observing that became very satisfying.
Well, you say at pretty much near the end of your monograph, it's pretty much cosmic, and that by moving the country, you're gifted with an eye and a heart-opening experience that has been exactly that. Exposing you to everything that is cosmic. You had, unfortunately, last several years, a series of fires in your area. Brutal fires. How has that affected you? You said you had some observations that might be worth sharing about what the impact of that has been.
Yeah, it really brought home the importance of regenerative farming right now, and earth care, and the way that we engage, the way that we can participate, what we have to contribute to taking care of this planet. And I think that part of going back to the sun and this environment, the sun and the moon, the bright light that is the sun, there's no light brighter than the sun. And there's no better night cycle than the subtleties that the moon provides and the stars provide. Well, because of the emphasis that humans have on living a life so dependent on fossil fuels, so dependent on living an interior life, a life inside, that we are in incredible imbalance with the earth and with the natural forces and providing for the earth and what the earth needs, because we keep taking more than we give. And when the fires were happening this year in California, the largest wildfires in recorded history in California, it was incredibly striking how out of balance things have become. And so it made me consider more than any other time since I've been up here, how I can participate, what I can do to participate in carbon sequestration, what I can do to be a better land steward, what I can do to learn more about forest care, and also what I can do to contribute less to using fossil fuels. So how carbon neutral can I become? What is my responsibility? And so it really was a call, I think, to personal responsibility. And that more than anything else was my takeaway from the fire, was the personal responsibility piece. How can I keep this top of mind all the time? How does this work into regenerative farming? And what can I do to help not only myself, this land, the community? How can I engage and participate? And how do my practices, how do all of our practices affect the whole?
I'm almost speechless, so that is rare for Michael Green. You know, thank you for sharing all this. In my mind, you truly are representative or embody what I like to call cannabis consciousness. This awareness that grows through attending to or being tended by the plants. What I've encountered in speaking with people across multiple walks of life in their experience, but in a manner of speaking, in Moon Maid, a monograph about a farm, you have summed this up in one place so well. Tina, thank you so much. I hope all your grows are successful, and I look forward to coming up and visiting you again sometime up there. And is there something else you'd like to add on the back end here before we say goodbye to everybody?
Michael, I appreciate your time, and I appreciate you making this happen, and caring for the books and intelligence and knowledge. I think that for you, that passion, it's so important, and how you learned that passion. For me, this passion is important, and we each have this finite amount of life energy and something we can contribute. And it feels good to optimize that as much as possible. So I think the takeaway is that living things come first, and to contribute more than you take.
I couldn't put it better. Thank you for your very kind words. And thank you
so much.
Sharing your experience. Namaste, my friend.
But I wanted to get this part in too, because it really rung a chord with me. It's like you were a new embodiment, if you will, in part, of what I got out of Rachel Carson in Silent Spring, when she wrote, "Those who contemplate the beauty of the earth find reserves of strength that will endure as long as life lasts. There is something infinitely healing in the repeated refrains of nature, the assurance that dawn comes after night and spring after winter." And again, that was Rachel Carson from Silent Spring. Tina, thank you very much. You grow a fine quality medical cannabis. There's no question about that. Obviously, your love, your focus, appreciation nourishes the plant, and it's nourished you, and it's nourished all of us. Thank you so very, very much for participating with us. I'll look forward to seeing you again in the near future. And I recommend Moon Maid. You can find it at cannabis-libris.com. Signed. Have a great day. Thank you.
Hi, my name is Sarah Daniels. I'm a PhD student in the clinical psychology program at the University of British Columbia's Okanagan campus. So I'm up here in Kelowna, BC on the unceded territory of the Syilx Okanagan peoples. And I do research here under Dr. Zach Walsh in the Therapeutic, Recreational, and Problematic Substance Use Lab. I am also an avid yogi and yoga teacher. I teach classes, and I also lead yoga teacher trainings through the lens of combining our historical, traditional, and spiritual knowledge with our modern understanding of psychology and kinesiology. My research focuses on combining two areas of interest for me, cannabis and yoga. Individually, both cannabis and yoga have tremendous therapeutic value, and I'm interested in studying what happens when we combine them. There are two main questions we're asking in our research with their own respective paradigms. The first is comparing the effects of yoga with and without cannabis. When we think of yoga, often the first image that comes to mind is a studio full of people bending their bodies into all these crazy shapes. But the physical practice that we most often think of is just one small piece of a really rich spiritual wellness tradition dating back thousands of years. We see early archaeological evidence of yoga in carvings and paintings in Egyptian temples well over 5,000 years ago. And in the area that is now northern India, there's a lot of documentation of the practice starting around 3300 BC. There are many lineages and traditions of yoga, but the philosophical basis of what we mostly practice in North America today follows the eight-limbed path, consisting of personal ethics, breathing practices, attention, meditation, mindful movement. This eight-limbed path was described by a yogic sage named Patanjali in the Yoga Sutras, a text that was compiled around 200 AD. And the Yoga Sutras are written as a really practical, action-oriented game plan to reduce suffering and achieve enlightenment. And enlightenment isn't referring to some esoteric, unreachable concept. It's referring to self-realization, recognizing the true nature of the self and of life. Like many traditions, the Yoga Sutras attribute suffering not to the forces outside of us, but to our flawed and limited perception of who we are and the nature of life. And the idea is that by clarifying our perception, being able to see things as they truly are without our own mind getting in the way, we can reduce our suffering. This is also the basis of many of the most commonly utilized therapeutic approaches in psychology today, utilizing tools to evaluate and address our thoughts and perceptions. I really never cease to be amazed by the overlap between our gold standard approaches we use in psychology today and what the ancient yogis were doing thousands of years ago. And in fact, recent research has demonstrated common underlying mechanisms between yoga and the third wave therapies we have today. Things like mindfulness, awareness of internal experience, and acceptance are all common threads. The practice of yoga itself has been linked with ample therapeutic benefits, including improved emotional regulation, improved attention and memory, and increased quality of life. And it's also been associated with decreases in anxiety, depression, sensory pain, medical symptoms, and inflammation. While yoga can be an incredibly beneficial practice for improving health and wellness, previous studies investigating barriers to participation cite health issues, joint pain, and attentional difficulties as major obstacles to participating in yoga. This is one area where we can look at how adding cannabis to yoga may help individuals to access this practice. As we know, one of the primary therapeutic uses of cannabis is for pain management. Participating in yoga can be really therapeutic for functional pain as well, but if you're in too much pain to engage in yoga, you can't access the potential pain relief of the practice. Similarly, yoga can be therapeutic for individuals with attentional difficulties such as ADHD, but again, the condition itself can act as a barrier if the attentional difficulties and hyperactivity present an obstacle to attending to the content of the yoga class. So these are just a couple examples of areas where enhancing yoga with cannabis may lower barriers to accessing the practice and accessing its potential benefits for the people who may stand to benefit the most. The practice of combining yoga and cannabis is also ancient. Humans have used both cannabis and yoga therapeutically for thousands of years, and it didn't take long to recognize the natural symbiotic relationship between the plant and the practice. There are references to using psychoactive plants with yoga in ancient texts from millennia ago, and we have clear historical records indicating that the practice of combining cannabis and yoga was popular in India since at least the 7th century. While not all sects of the yogic tradition support the practice, some, such as the sadhus, yogis who are devoted to Lord Shiva, who is the god of both yoga and cannabis, regularly combine cannabis and yoga in a ritualistic manner. Physiologically, cannabis and yoga demonstrate a natural synergy, as some of the positive effects of yoga have been attributed to its effect on the endocannabinoid system. Contemporary ganja yogis who regularly enhance their practice with cannabis comment on this synergy. They often note that adding cannabis helps to get more out of their yoga practice. It helps them drop in quicker and deeper. And this highlights another potential widespread benefit of cannabis-enhanced yoga in our Western society today. Unfortunately, many people are living incredibly busy lives, whether it's work, education, childcare, anything else, all of the above. We're often left with limited time for self-care. As a PhD student, I can attest that if you're coming out of an incredibly long, stressful day into your 1-hour yoga class, by the time your mind stops racing and you get settled in and present, the class is over. For those in this position, many report that cannabis-enhanced yoga helps them to maximize the benefits of the practice, helping them to fully arrive and be present, to drop in and connect inward as soon as they arrive on their mat. In this way, cannabis-enhanced yoga can be an incredibly valuable tool for well-being in our modern society. We've been talking about cannabis-enhanced yoga. The second paradigm we're investigating is the idea of yoga-enhanced cannabis. Coming from a clinical psychology perspective, I'm mostly going to be focusing on mental health here. Managing mental health and enhancing wellness are some of the most prominent motives for cannabis use. However, a recent meta-analysis conducted in our lab indicated that cannabis use is repeatedly associated with both positive and negative impacts on mental health across a variety of conditions. For example, cannabis use has been associated with decreased anxiety, but also with increased anxiety. Cannabis use has been associated with improved mood, but also with a higher risk of developing depression. One potential explanation underlying this contradictory literature may be the role of set and setting. The term set and setting refers to the extra pharmacological factors that can impact the effects of a psychoactive drug. Set refers to internal factors, such as the individual's mindset, personality, intention, and expectations. Setting refers to external factors, such as the physical environment and social and cultural factors. The set and setting hypothesis proposes that these non-pharmacological factors are primarily responsible for the subjective effects of a psychoactive drug. While the term is relatively new, the importance of context when using psychoactive drugs has historically and traditionally been revered and strictly upheld. Historically, cannabis use was embedded within ceremonial and spiritual practices such as yoga, meditation, chanting, prayer, or ceremony. In contrast, cannabis use in North America today often takes place in a set and setting where the practice is, first of all, highly stigmatized, if not illegal. In North America, cannabis use has seen a degree of normalization in comparison to other illegalized drugs. However, there are still pervasive legal sanctions and stigmatization that impacts cannabis users, even in countries such as here in Canada, where we have a federal legal framework. 18 months after legalization, almost 20% of polled Canadians reported that they would be concerned if they were seen purchasing cannabis from a legal government facility. And over a third of Canadians reported stigma in their place of work if their cannabis use was known. This stigma is a cause for concern because previous research has identified the stigma related to cannabis use as a primary cause of cannabis-related harms, rather than the cannabis use itself. In addition, the anticipation of stigma predicts to a degree the amount of psychological distress that an individual experiences, as measured by depression and anxiety symptoms. The traditional set and setting for cannabis use, embedded in supportive spiritual or ceremonial practices, is in stark contrast to cannabis use today, which for many occurs in an unsupportive psychological and sociocultural environment. One promising approach is to examine how we might better integrate the vast body of traditional knowledge with current therapeutic use. The flip side of cannabis-enhanced yoga is yoga-enhanced cannabis. Can we maximize the therapeutic potential of cannabis by paying attention to set and setting? By coupling cannabis use with an intentional, mindful, supportive container, especially in the context of mental health and well-being. Yoga is one example of a potential container that may maximize potential benefits and minimize potential harms. I've recorded a guided practice if you are interested in trying cannabis-enhanced yoga or yoga-enhanced cannabis, however you see it, for yourself. It's about 45 minutes long. All you need is a space with enough room to lay down and move around. Essentially, if you have a space where you could do some semblance of a snow angel on the ground, that would be ideal, but you can make it work in a smaller space as well. Pay attention to the space as an element of setting. Ideally, it will be somewhere quiet and private where you feel comfortable. I often like to set up a really intentional space with spiritual or self-care elements. For me, that might be candles or lamps, essential oils, sage, whatever that looks like for you. Some other things that you may like to have could be a yoga mat if you have one. The purpose of the yoga mat is to provide some grip and provide some cushioning. So it's not necessary, but just keeping in mind that you want to be able to have some grip on the ground and also some amount of cushioning, especially because we will be lying on our backs for a portion of the practice. That brings me to the second thing that's helpful to have on hand, which is a blanket. You can get really nice yoga blankets, but any blanket you have around your house will do. I often use it as support to sit on, to cushion my knees in a tabletop position, to cushion the ground when lying on your back or your stomach, or to get warm and cozy in Savasana at the end of the practice. For this particular video, you will also need a strap or something to use as a strap. So this could be a tie, a belt, a scarf, any long piece of fabric. You'll also want to have some water on hand and be wearing some comfortable clothing that you can easily move in. Once you've gathered your supplies and set up your space, get your cannabis ready. If you're using edibles, you'll of course want to consume them significantly before your practice time. No matter how you're consuming your cannabis, see if you can do so mindfully, even ceremonially. Take your time. Really notice the taste, the smell, the feel of your cannabis. Think of it as part of the yoga practice. As for recommendations for strains and dose, etc., everybody is different, and if you regularly use cannabis, you probably already have an idea of what strains work well for you and which ones affect you in a way that would pair well with yoga. If you're new to cannabis, start low, go slow is your mantra. You can always add more, but you can't necessarily take it away. In general, even if you use cannabis regularly, it's often recommended to maybe be a little bit less high than you might usually be when you're combining it with yoga, because they really do amplify each other. And many people find that less is more in this case, but again, it's going to be an individual experience. The video of the recorded class begins assuming that you have already consumed cannabis. So I would suggest getting your space set up, gathering your props, and queuing up the video, and then mindfully consuming your cannabis, and then hitting play when you're ready. The class opens with some breathing and meditation, and then moves into some gentle mindful movement, staying really low and supported on the mat. Throughout the practice, it's important to listen to your own body. Know that you're absolutely free to modify as much as you like. as long as you're intentionally connecting inward and resolving to stay present with your body, your mind, and your breath, you're practicing yoga. If you're looking for more resources on cannabis and yoga, I have two fantastic books to recommend. The first is the book titled Ganja Yoga by Dee Dussault. I completed her Ganja Yoga teacher training program with her a few years ago, and her book is a really great guide to a home practice and has a great background on the practice as well. The second is the book called The Lotus and the Bud by Chris Killam, also known as The Medicine Hunter, and that's also a wonderful guide and overview of the practice. If you have any questions or want to discuss further, you're always welcome to connect with me via email or social media. I'm always happy to continue the conversation on cannabis and yoga. Thanks for listening and connecting with me today, and I hope to practice with you soon. We are currently recruiting participants for our survey-based study examining cannabis and/or yoga and meditation. So you don't have to have any experience with yoga or meditation in order to participate in this survey. You just need to reside in North America, be over the age of majority where you live, and have experience with either cannabis, yoga, or meditation. For participating, you will be entered into a draw to win gift cards or a copy of Dee Dussault's book, Ganja Yoga.
The Interpening Loop is our most sophisticated tool, packing in an unbelievable amount of new cannabis information, which guides you through identifying cannabis quality and effects. The first page identifies speciation, correct terminology, the aroma perception, physical characteristics of flower, and much more, which will ultimately help you determine the effects of the flower you have. The second page describes the most common flaws of cannabis, so you can decide if it's safe to consume or not. The third page covers the most acceptable and highest qualities of cannabis, focusing mainly on trichome health and density. And finally, the fourth page lists the 6 most common terpenes found in cannabis and how they correlate with the effects you experience. That is the Interpening Loop. This is the dual Interpening Loop, and it has 2 levels of magnification, along with a bright LED light for each eyepiece. The larger eyepiece is great for identifying the overall quality of cannabis. You can easily see things like trichome density, pistil health, and other positive characteristics, while at the same time looking for flaws such as mold, mildew, insects, and more. The smaller eyepiece has a higher magnification and is ideal for identifying trichome ripeness before harvest and after flower is dried and cured. A jeweler's loupe is by far one of the most important tools for interpeners and cannabis enthusiasts alike. This is the weed wheel, which is a super cool and dynamic interpening tool. The front of the wheel helps you gauge the spectrum of psychotropic effects of cannabis by simply spinning the wheel to identify the flower structure, scent characteristics, and aroma perception. This allows you to pinpoint which type of effect you will experience with different types of marijuana. From there, the wheel has a graph that describes the different experiences and effects within the broad to narrow leaf spectrum. The back of the wheel explains why cannabis isn't as simple as indica or sativa and includes a tolerance graph to help you gauge the intensity of the experience based on how much is consumed and the individual tolerance. So, whether you're an interpener, honing your skills, working with customers as a bud tender, or coaching clients with their cannabis use, the weed wheel is a great visual tool you can use to guide you and your clients through the various effects and experiences with cannabis.